YouTube channel, One Race, Human Race, All Human. Look at what the big lie has done
contagious
down south.
Delta variant, and by a definite slowdown in vaccination rates across the country. In some states, the human toll of the pandemic is worse than ever. One of those states, Missouri. The daily case rate there is more than triple the U.S. average. Now, health workers in one county are sounding the alarm and asking the state to fund an alternative care site as they prepare for a surge in people who need to be hospitalized. Joining me now is Katie Towns. She is the acting director of health department in Springfield, Greene County, Missouri. Katie, thanks for coming on the show. What are you seeing in your county right now?
Thanks for having me. So today we're in the middle of a complete surge in our hospitalizations. The numbers of cases continue to rise. And we are just at a place where we need help, like was reported. We need an alternative care site, and we've requested that from the state.
So are these mostly unvaccinated people that are getting infected? Are you seeing younger people? Try to give us a little more detail on how this is playing out there in your county.
Yeah, so currently we still are hovering just around 40% of our county is vaccinated, and that's of the eligible population. Those that are hospitalized are those who are unvaccinated. And unfortunately, talking to healthcare professionals that work right here in our community, there's a lot of regret. And if folks are getting sick and they're ending up in the hospital, and all of a sudden they're expressing the fact that they wished that they would have been vaccinated. So we're trying to use any of these opportunities to sort of share that regret and make sure that people understand that there's something that you can do now, and that can help prevent a lot of this illness and death that we're seeing in our community.
In other words, they believe the lie, okay, about the COVID-19 and the Delta variant. It's real, and you need to get vaccinated and wear your mask and socially distance and not believe the lies they put out there. Jesus said, I'm come that they might have life and have it more abundantly.
How would you describe your level of concern right now?
I'm extremely concerned. Our projections are showing that we probably won't see a peak in these cases and the numbers rising until sometime in August. And that's a long time from now. And so our resources are thin right now as we've asked for additional help. And to get to August before we see a peak and start to see these cases come down, it's going to be difficult. I'm proud of our community. We have a tremendous set of leadership here that has banded together, and we are working on a collective way that we manage the situation. We're strong and we are resilient, but we really just wish that people would hear the message loud and clear and get vaccinated while you can.
And you talked about how some who chose not to get vaccinated then became very ill with COVID, expressed regret. What is the main reason you're hearing from people who are making that choice to not get vaccinated?
So there's a lot of different reasons, but I would say the primary reasons that we hear people saying that they haven't chosen to be vaccinated yet is that they're waiting to see the long-term effects of the vaccine, and that they've already had COVID and believe that they have protection from natural immunity, which we are definitely seeing play out in the fact that people who have had COVID in the past are ending up in the hospital. So that's not a good form of protection. And, just sort of the other conspiracy theories that have been spread and misinformed people. So unfortunately, we're hearing a lot of different reasons.
And how much do you think misinformation has played a role in that? Misinformation spread on social media?
It's tremendous. I mean, people are hearing rumors about the lack of safety, the lack of length of time that this vaccine has been tested, and it has played a tremendous role in people being fearful. And we're trying to overcome that, but it has definitely taken a stronghold and has prevented people from taking part in the vaccine, which is the tool that we need, and we will use in order to create a long-term solution against this virus.
Right. It's an effort. It's a united effort to end this virus, right? We all need to kind of be in this together. It has to be. That's how you ended polio and other big diseases in the past.
Right.
All right, Katie Towns, thank you for coming on and sharing what you're experiencing there on the ground in Missouri.
Thank you for
the Delta
covering.
variant. No problem. And we were just talking with Katie about that Delta variant. It isn't just causing a rise in U.S. cases, like in places like Missouri. This week, the head of the World Health Organization said it's traveling around the world at what he calls a scorching pace. Many nations are suddenly finding themselves caught between reopening plans and the growing realization that this pandemic is far from over. Our CNN reporters have the latest developments.
There's one race, the human race, and all people on this planet known as Earth have a right to life, liberty, and pursuit of happiness.
For Canada, this is quite a milestone given the slow start that it got off to. Now, both Canadians and Americans now at over 48% fully vaccinated. But if you go back to a split screen, even in May, Canada had very few people fully vaccinated. It was trying to get as many doses as possible, first doses, into as many people as possible. And the reason there has been a lot less vaccine hesitancy here was what was unfortunately in the spring and late winter a punishing third wave of the virus. Hospitalizations were through the roof. They had to transfer patients from hospital to hospital just to make sure that they could get care. And really, cities like Toronto, in fact, have only now emerged from lockdown. Canada is still being quite cautious. They say that they will open borders to fully vaccinated international visitors, possibly throughout August and September. But they're saying that because of the Delta variant, they will continue to be quite cautious. Paul Newton, CNN, Ottawa.
I'm Phil Black in Essex, England, where daily confirmed COVID-19 cases have now soared to a point not seen since the last winter peak, and they're expected to keep climbing much higher, just as the government is preparing to throw away the pandemic rulebook in England from Monday. No more rules about social distancing, masks, or crowd sizes. Reopening in the middle of a growing wave hasn't been tried by any other country. And even the government's own scientists say they can't be sure how it's going to turn out because it will ultimately be determined by how cautiously people choose to behave. There are critics here internationally who describe this as reckless and unethical because they say the Delta variant is so contagious, the vaccine program is incomplete. So inevitably, in the near term, vast numbers of people will fall ill, many of them seriously. And there are also concerns this creates the circumstances in which new mutations, new variants could develop, and there's a significant risk some of them could be better at getting around the currently available vaccines.
I'm Arwa Damon in Istanbul. The World Health Organization is warning that the Middle East and North Africa are nearing a critical point due to a surge in COVID-19 cases, largely due to the Delta variant, as well as significantly low vaccination rates. Tunisia has gone into lockdown and is warning that its oxygen beds and ICU capacity are nearing a maximum. Iran, the hardest hit country in the region, is about to break its own infection records, and Iraq is reporting its highest mortality rate to date. There are grave concerns that numbers will only continue to rise as we are about to enter the Muslim holiday of Eid al-Adha, which is traditionally marked by gatherings and social celebration.
Our thanks to all of our reporters around the world. Well, she lost her mother to COVID. Now, an Arkansas nurse has a message for those who don't want to get the vaccination. I'm going to talk to her coming up in the show. But first, members of New York's Attorney General